And my name is Christy. I am the Knowledge Translation and Implementation Coordinator with the Waypoint Research Institute. And Dr. Zoe Hilton is here as well. She'll speak a little bit more to this particular Waypoint Talk series, but this event is sponsored in part by funding from SHRC, which is great. So we just want to start with a land acknowledgement. Waypoint Research Institute and the Waypoint Center for Mental Health Care is located on the traditional territory of the Anishinaabe, which include the Odawa, Ojibwe, and Potawatomi nations, collectively known as the Three Fires Confederacy, the Haudenosaunee, Huron-Wendat, and Métis peoples. We acknowledge and affirm our commitment to improving relationships between nations and to improving equity for Indigenous communities residing in the Central North region of Ontario. We also want to acknowledge September 30th in Canada as the National Day for Truth and Reconciliation. So each year on this day, we recognize Orange Shirt Day. It's a movement started by survivor Phyllis Webstad to commemorate when her clothes, including her new orange shirt, which was a gift from her grandmother, were taken away on her first day at the St. Joseph's Mission Residential School. And by wearing an orange shirt on September 30th, you make a statement to support reconciliation and commit to the enduring truth that every child matters. And so pictured here is the survivor flag from the National Center for Truth and Reconciliation. This commemorative flag was created by survivors to share their expression of remembrance with the broader public and to honor all residential school survivors, families, and communities impacted by the residential school system in Canada. I encourage you to reflect and take some time today to seek out some resources and learning, and the National Center for Truth and Reconciliation is a really great resource for that to learn more. So welcome to Waypoint Talks. This is a virtual webinar series hosted by the WRI, and we aim to highlight practical implications of research projects. We do have another stream around building your research toolkit, and that stream highlights some best practices used in mental health research, quality improvement, and program implementation. And so these events are open to all who are interested in learning about emerging research, best practices, and clinical innovation. So just a couple housekeeping notes before we get started. Waypoint Talks is hosted as a Zoom webinar, so please use the chat box and Q&A function to connect with the speakers and your fellow attendees. We will also have dedicated time at the end of the presentation for Q&A. The session can go until 12 p.m., but it's also okay if it wraps up sooner. So please continue to use the Q&A function or chat throughout, and I will keep note of your questions, and we'll get to those at the end. We also will have the recording and the slides available after the event on the WRI website, and we'll also send around a post-event survey. We do appreciate your feedback. It helps inform our future events. There's also certificates available for every Waypoint Talk session, and we'll let you know how to get those at the end of today's session. And so with that, I will pass it over to Dr. Zoe Hilton to introduce today's speaker. Oh, actually, Zoe may need a little bit of extra info for that. So maybe Zoe, I can introduce Amanda and then you can join us for the Q&A session if that helps. So today we have Professor Amanda Robinson with us. She's a professor of criminology at Cardiff University in the UK and co-director of the Security, Crime and Intelligence Information Innovation Institute and director, University's Police Science Institute. She was directly involved in shaping the Welsh government's white paper proposals that led to the Violence Against Women, Domestic Abuse and Sexual Violence Wales Act in 2015. Dr. Robinson's research includes a strong policy focus aiming to advance knowledge in relation to how the police and criminal justice system, health and community-based agencies can best respond to violence against women, domestic abuse, and sexual violence. In particular, Dr. Robinson has published on police practitioner understandings of coercive control offenses in the UK, on culturally appropriate responses to intimate partner violence, IPV, and victim experiences of justice. And Dr. Robinson is kicking off the beginning of our series on coercive control. So welcome. Thank you so much, and over to you.
Okay, thank you very much for that introduction. Let me know at any time if the sound goes or I need to make any kind of adjustments because I'm basically speaking into a black box and I have no idea what facial expressions or issues might be coming up. So I'll trust you to help me along if there's questions in the chat or any issues come up. So I'll share my slides and hopefully this will go smoothly. So I'm assuming everything is okay with that. Let me go to slideshow.
Everything looks good.
Okay, thank you. So I just wanted to say thank you so much for this invitation. I know how challenging it is to find time in your busy schedules to take out to listen to someone you don't know. You don't know if the time is going to be useful or not. So I appreciate the trust. I know that Zoe Hilton is a great colleague and she's been to Cardiff before. And so I'm happy to continue on these links between our two institutes. And today I thought I would talk about the experiences we've had in the UK criminalizing coercive control in the hopes that some of our learning over the past few years is of relevance and potentially helpful to your journey in Canada, doing similar with implementing legislation to criminalize coercive control, which I know is in the works. Um, sorry, So the talk is divided into two broad sections. The first, I just want to give an overview as to the background context in the UK. I mean, the UK is very different to Canada, as the introduction about your National Remembrance Day today highlights, and we can't assume that things that work here translate easily into your context. So I want to give some kind of background context to the UK and how we came to criminalize coercive control and what we've learned about the challenges that that presents to different agencies working to respond to people who have experienced violence as either victims, perpetrators, or children. Then the second part of the talk is roughly around what changes have taken place to the UK context post-implementation of our law, and what we've learned about that process in terms of how we have seen changes arise from implementing tools and processes that nudge better performance within existing service delivery models. And then some examples where it has been necessary or advantageous to initiate what we consider to be alternatives to business as usual approaches. And all of what I'm going to talk about is drawing on my own research. I haven't put up loads of references throughout, but I have a lot available on my web profile, and I'd be happy to take any emails for further information or to signpost to specific references at any point in the future. So first, just a little bit of background. So what you're looking at now is three images of Cardiff University. The largest photo is of the Glamorgan building, where the School of Social Sciences is based. And that is where I came in 2001 as a lecturer in criminology from Michigan State University. So it's quite a big culture change. I can't even say honestly if I was absolutely sure what Wales was and how Wales was part of the UK, its own country. My knowledge was pretty rudimentary. But the School of Social Sciences has been a great home to me ever since. And one of the main reasons for that is that it houses academics working in very applied ways often, but not entirely, from a range of disciplines. So sociology, social policy, criminology, psychology, social work. So you get that great influx of different perspectives. And I think that's been really important throughout my career as a criminologist, because I've not been kind of located in a venue where everyone is studying the criminal justice system. People are studying other aspects of social life, and that has informed my research in various ways going forward. And then if you were sitting inside the Glamorgan building, what you'd be looking out to is that round statue of World War I commemoration in terms of the veterans that fought in that World War. And then the image below that is the Spark building, and that is the Social Sciences Research Park, which opened up around 3 years ago. Zoe Hilton has had coffee with me there, and it's a new building, very different from the Glamorgan building, where research institutes from various parts of the university, along with non-academic, non-university stakeholders, occupy the building in the hopes of furthering collaboration and working to translate research into practice and to solve social problems across many different aspects of life. So I know that you're in a very different place. Sometimes that helps to get a little bit of insight as to where I'm speaking to you from. So currently I'm in the Spark building where the Security, Crime and Intelligence Innovation Institute is located. I know that's a mouthful, but that's a research institute that brings together computer science, violence prevention and health, and criminal justice and criminology into a single institute. So that's my specific local context. And now I want to just give you some national context around domestic violence and policing in the UK. And by in the UK, in this instance, with this slide, I'm really referring to England and Wales for the most part. Scotland is fully devolved, so they have Scottish police and Scottish government. They have no obligation to report to the Home Office. So most statistics that are national are actually in reference to England and Wales. So those different outlying territories on the map are the 43 police forces across England and Wales. And every year, the Office of National Statistics publishes a compilation of the findings from the crime survey for England and Wales, along with police and criminal justice statistics. They used to be published separately, so you had to merge those findings together, but now they're published as a single resource, which is really useful, obviously, for understanding the dark figure of crime or those criminal incidents that are never reported to police, for example. And so for the latest figures for the 12 months ending in March 2023, we see that there's about 2.1 million adults who responded to the crime survey for England and Wales that they had experienced some form of domestic abuse. And adults here are defined as, for the purposes of the survey, those who are over 16, but not older than 60, which is a major issue with our crime victimization survey. So we have over 2 million adults a year reporting that they have experienced domestic abuse. We have less than half of that coming to police attention and recorded as some kind of domestic abuse crime. So I put domestic abuse related crimes because we don't have a single offense, a single criminal offense for domestic abuse. Instead, it all hinges on the relationship between the victim and the perpetrator. And then we apply the criminal law and all the different criminal offenses that might be pertinent to a particular incident of domestic abuse, from homicide to sexual violence to property offenses, stalking, you name it. So domestic abuse related crimes is a hugely diverse set of different types of criminal offenses. So less than half come to police attention, and then of those 900,000 or so crimes that are recorded by police, you see that a far lower number, about 70,000, are have a suspect who's been arrested and charged. Charges again go down the Crown Prosecution Service, around less than 50,000 prosecutions per year. And then we have about 40,000 convictions per year across England and Wales. So it's a huge problem of attrition, which is not unique to the UK. I think the UK is very good about being transparent about the scale of the attrition. And I just wanted to put this up to kind of situate you into the UK context, but also to highlight at the outset where coercive and controlling offenses fall in this picture. And you can see in that last block there, we had less than 600 convictions. So 600 convictions out of 40,000 convictions for domestic abuse. And then we know that over 2 million adults a year report being victimized, and a significant proportion of those will have experienced coercive control. So although we've had a coercive control law for some time, we still see it as a minuscule representation within the criminal justice system, which I'll come back to. So policy and legal reforms, we've been on a journey for more than a decade, making coercive controlling behavior visible in the policy and legal landscape in the UK. The first major change happened in 2012 when the Home Office consulted on the cross-governmental policy definition for domestic abuse. And because there is no single criminal offense, the policy definition is important because it draws the boundary of, what is domestic violence and abuse and what is not. So over time, that definitional boundary has expanded and expanded to include different types of relationships, for example, regardless of gender and sexuality, for example. And the last major change was put into effect in 2013 when the definition was amended to state that it could be any incident or a pattern of incidents, and it specifically mentioned coercive and controlling behavior. It applies to intimate partners or family members in the UK, the definition, regardless of gender or sexuality. So it is much broader category of offenses and incidents than what we would consider to be intimate partner violence. Domestic violence and abuse in the UK also includes familial violence. Now, in 2021, we had a Domestic Abuse Act, which made this definition a statutory definition. And that's important for reasons I'll come on to. And then I've put a couple of other national policy reforms, which are probably important to know about. The first was the National Institute for Clinical Excellence. This is the health advisory body who puts out public guidance on various topics that is aimed at health practitioners. And they had, not until 2014, did not have any national public guidance about what the role of health providers was in terms of domestic violence and abuse. And I was involved in the group that put out this guidance. So it's still available. It was updated to some extent in 2018. But in that guidance, it refers to coercive control and the fact that domestic violence and abuse is gendered and disproportionately experienced by women, although the national definitions apply to people regardless of gender or sexuality. And then NPCC is the National Police Chiefs Council, which represents the chief constables of all 43 police forces in England and Wales. And they put out the Policing Violence Against Women and Girls National Framework for Delivery. This is the current framework, national framework for delivery. And I call it to your attention today because it was published earlier this year. It was a very significant publication in terms of the leadership of policing from the very top, making violence against women and girls a strategic policing requirement on a par with counterterrorism and organized crime. So for the first time, and not until this year, was policing oriented at a national policy level to consider violence against women and girls as a significant issue as terrorism and organized crime. So we have had policy and legal reforms, all of which make reference to coercive control And so the kind of prominence of the concept, prominence of not only criminal justice, but other service providers such as health, recognizing and putting in coercive control into guidance, into policy. And I think that is significant because it takes from a lot of different angles. It's reinforcing a message that, or trying to reinforce a message and raise awareness and understanding that domestic violence or domestic abuse isn't necessarily just about physical violence, which is a very difficult message for many people to understand or believe. In terms of criminalizing coercive control, so we had policy reforms happening, policies, guidance, research coming out, but it wasn't until very late in 2015, at the end of December, was the crime of controlling or coercive behavior in an intimate or family relationship made a criminal offense. So that went into force at the very end of 2015. And so we were the first, England and Wales were the first of the UK nations to make that behavior illegal. It was important for many reasons, and I know that you will be aware of the pros and cons of criminalizing coercive and controlling behavior. So I won't spend a lot of time talking about that. But what it was aiming to do was to fill what was perceived to be a gap in the law because we don't have a criminal offense of domestic violence or abuse. So it was about adding in a law which really reflected the lived experience of victims and wasn't duplicating any other law. So it wasn't replicating what was already there, but it was adding in a law around the controlling and coercive behavior, which was not covered elsewhere because the stalking legislation did not apply if you were in an intimate or family relationship. Scotland, Ireland, and Northern Ireland also have laws now that criminalize coercive and controlling behavior. So the crime of coercive control in the UK has been policed and been going through the criminal justice system to some extent since 2016. Examples of perpetrator behavior from the statutory guidance are listed on the slide. So at the time the law was put into effect, there was statutory guidance made available to try to allow or enable practitioners to see what kinds of behaviors they should be looking for. The Crown Prosecution Service also put out guidance around how to collect evidence in these cases. You see there are two different dates, 2015 and 2023, and that is because the statutory guidance was updated in 2023 because the Domestic Abuse Act in 2021 made an amendment to the original law. And when the original law was passed, what it specified was a range of relationships, what you might expect, people married, people in an intimate partnership, ex-partners, people with shared parental responsibility, and because it applies to family members, people that are relatives. But it had a clause about requiring the people to be living together and for that relationship to be current. And so the Domestic Abuse Act 2021 amended that so that it applies now to people who are not currently in such relationships, nor do they live together any longer. So it's broadened it out once again. So the statutory guidance provision in the UK, those are quite important documents. They're the guidance that practitioners go to around how their practice needs to be amended or changed as a result of new legislation. And by for the most part, they do a good job of laying out what needs to be done. What does it look like? What are the ways you can collect evidence? What are the particular considerations that you need to be mindful of? But they are fundamentally just documents, right? They're policy documents, guidance available. They can land in an organizational context or landscape where people have not been given, practitioners have not been given any space or time to read it, any supervision or any training, any monitoring of whether their practice has changed as a result. So I think it's just important to pay attention to, or as a reminder of what was in place when the law came into force. There was statutory guidance available. There wasn't widespread training, which I'll go on to. And so over time, it's been quite a slow learning curve, you might say. So this slide shows police recorded crime. The orange columns are any kinds of domestic abuse related offense for each year, and the blue columns are the proportion that are recorded that are the new offense of coercive and controlling behavior. And you can see there that, it's a very, very small proportion of the overall total, even though reviews by the Home Office would estimate that there's at least 500,000 out of those 2 million roughly every year that experience domestic abuse that would be experiencing coercive control. So we have some upward movement there. From about 4,000 crimes recorded in 2016 to about 40,000, or roughly 1% to 5%. So the shape of the graph is in the correct direction, but the scale of change, you could argue, is quite slow, because we've been doing this now for nearly 10 years, and it is still, only 5% of the total amount of domestic abuse that's coming to police and criminal justice attention is down to coercive control, even though we know that the experience of those behaviors is much, much greater. So trying to understand why this kind of situation exists, what are the challenges, what are the reasons for this low visibility of coercive control in the criminal justice system. And one of the things to understand about the UK is that we have a pretty established and embedded risk-led approach. And what I mean by a risk-led approach is this is in reference to the criminal justice system and policing primarily, but it does involve other partners. So this has been, for 20 years at least, the idea that there needs to be some kind of risk tool guiding police judgment at the scene. So in Cardiff, the initial tool was developed in 2002, so more than 20 years ago. Likewise, London developed a short risk tool for frontline officers to use. And by risk tool, I mean a series of questions that the police officer would be asking of the victim that are drawn from research evidence around the correlates of further harm, escalating violence, and even homicide. So the idea was that if they asked those questions, they would get a better sense of the risk that particular victim faced going forward, and that they could try to tailor their service delivery accordingly, because domestic violence places a huge demand on police here in the UK, as I'm sure it does in Canada. So it was a way of triaging, if you like, and focusing more resources on those victims that were deemed to be at higher risk, and intervening in those cases in a different way. So I think the UK is it used to be unique in this regard, but we know that risk-led approaches and risk tools have proliferated. I think what is still unique about the UK is the centralization and the coverage of a particular risk pathway, if you like, which is that most UK, nearly all UK forces use the DASH risk tool. But even more importantly, multi-agency partners also use that same tool. And that's been the situation since 2009. So by multi-agency partners, I mean specialist service providers for violence against women and girls. I mean health, I mean housing, um, social services, midwifery. It is a big multi-agency group of agencies that is used to using the DASH. And they use the DASH, and the point of the DASH is to identify those high-risk cases, which are then reviewed at a MARIC, a multi-agency risk assessment conference, where practitioners come together and basically create a multi-agency safety plan for high-risk victims. So MARICs have been going on since 2003. The first one was in Cardiff, and they've been national for nearly 20 years now as well. So you have this national infrastructure in the UK, which does set it apart in terms of the consistency of terminology and interventions in all the local areas. So there's probably more than 300 MARICs operating regularly, either weekly or fortnightly or maybe monthly, depending on the population and other local characteristics. And that is unusual. It's a positive because people are speaking the same language, but it becomes a negative if you need to make adjustments to this infrastructure, which everyone understands and has and is embedded deeply into the working of many agencies, which I'll come on to. So the DASH is the risk assessment tool I mentioned, and that involves 27 questions being asked by a frontline officer to a victim of domestic abuse at the time of the incident. The same tool could also be used by a specialist advocate in a community-based setting some days later, or by a health practitioner. But in terms of policing are the majority of the practitioners that use it routinely. And what we know about how they use it speaks to some of our challenges around identifying and responding to coercive control. So one study I was involved at looked at American and British police officers and their perceptions of the risk factors that were being used in their tools. Now, the American tool was the Lethality Assessment Program, or LAP, and then the British tool was the DASH. But so they weren't identical. The LAP is much shorter, but they do ask about the same kinds of correlates of violence. And what that study showed was that both officers from both countries were prioritizing in their responses physically violent risk factors, and much less so around any risk factors which could be deemed to be measures of coercive control. So you see those kind of high risk. So even though the DASH has 27 items, they really distill into those few items which are directly asking about physical violence. So we know that officers pay their conceptualization of domestic abuse, even though the definition is broad, in practice, how they view it is largely down to physical violence. And then we did another aligned piece of work comparing British and American officers and showed how non-physical abuse goes under the radar in terms of asking officers how they would respond to two vignettes which were identical, but one vignette had the sentence about physical violence removed. Otherwise, the victim and the perpetrator characteristics and the description of the incident, which had many, many high risk factors within it, the responses became very different once he removed that representation of physical violence. And so this reinforced the point right at the time that we had implemented this new law that, hey, look, police officers do a great job a lot of the time, and they can respond well to domestic abuse, but we need to bear in mind that what we know about their responses to domestic abuse are reflected by how they understand it. And when it's physical violence, a male perpetrator and a female victim, that coincides with how they understand it. But if it's not physical violence, if the relationship status is not heterosexual, or there's other factors, co-occurring factors, then it can be harder for them to see that as domestic abuse. So the challenges for effective agency responses that we've identified in the UK, which are probably similar or at least resonate with the Canadian experience. We know that the police occupational culture has tended to be a problem in terms of how police respond to domestic violence and abuse in many ways, and there's a lot of research literature on that. It's important to recognize that there's a lack of understanding by officers of the dynamics of domestic abuse, and that the impact of this on victims, and therefore the impact of how victims will want to engage with them or not in a police interaction. So we have these different agency responses. There's the broad definition. So it's really challenging officers to identify and categorize something as domestic abuse, which could be brothers arguing, it could be adolescent to parent violence, it could be siblings, it could be, all of those family relationships, as well as all the different intimate partner, variations, along with all the different types of abuse, including coercive control, which is a coercive conduct offense. So it's really requiring a sophisticated recognition on the part of responders. What we know about coercive control is that it's often a really individualized package of behaviors which are specific to that particular dyad of the perpetrator and the victim, that typically he will know what kind of behaviors are being controlled is specific to their context, to their relationship, to her individual needs and differences. For example, if there's any disabilities or alcohol drug misuse or asylum seeking or immigration issues, the coercive and controlling behavior is an individualized experience. So it really does require a lot of sophisticated understanding on the part of practitioners. And unfortunately, we didn't really help practitioners in a very concerted way in terms of giving them the time and space to understand what truly the impact would be of having a new law around coercive control. And you see there in 2022, so some years after the law had been implemented, we still had a very patchy landscape in terms of how many police had not been trained in handling domestic violence. And that's domestic violence, let alone anything specifically geared or making prominent coercive control within that. So that was only a couple of years ago. But the next two maps show that we have made better progress since then. So 2016, when first year that the law was in force, you can see the map there in terms of only one force having implemented the Domestic Abuse Matters training program. This was a training program that was co-created by the College of Policing in the UK and a national charity known as Safe Lives. And together they merged forces to create a new training program on the back of an inspection which showed how poor training was around policing domestic abuse. So they came up with a training program. The training program is designed to facilitate recognition and effective responses to coercive control. It's taken some years to get the coverage of that training into forces. You can see in the current map, we're nearly there. I mean, that doesn't say anything about the actual practice of those officers, but it does say that those forces, those police force areas, and their police officers within them have undertaken the training, which is specifically designed to enable them to better respond to coercive control. But ideally, the 2024 map would have been, we would have had that in 2016. I think it would have made a big difference if we had, as there was a lot of problems that came out because we didn't. So the next part of the talk, hope you're coping okay with all of this information, is I just wanted to give some examples of how we've tried to address some of the agency challenges that I've described. So the Domestic Abuse Matters training program is, of course, one thing, and that is important. It's a combination of classroom work, role play around specific domestic abuse cases, an online training module, local champions. I mean, it is much better than anything that has been in place previously in the UK for sure. But everyone knows that a training program can only go so far. There's a lot more that needs to be done. And a training program that goes against or contradicts in some ways the tools that police or other practitioners are using is also going to be problematic. So this slide is about nudging better identification and response for victims. And I want to talk to you about what has happened with our DASH risk model, which, as I said previously, that's the risk assessment tool that's been in place since 2009 in all police force areas, along with their multi-agency partners. And in 2016, so not long after the new law came out, we published a national review of risk-led policing and the police use of the DASH risk tool. And what that national review really highlighted was that the tool did not do very well in terms of nudging officers or helping them see coercive control. And now coercive control is a new offense, and the tool could do a much better job. And part of the problems with the tool is that it's long, it's 27 questions. There's only maybe one or two questions that you could maybe consider to be measures of coercive control. For example, is he jealous, or, is he constantly jealous of you? Does he try to control the finances? But those, when we went on observations with the police, we did a big review of case files, we did interviews with the police and partner agencies. And what all of that evidence showed was that often the questions were being misinterpreted at the scene, because officers didn't know that those couple of questions were meant to kind of indicate whether there was a coercive and controlling behavior within the relationship. So coercive control really wasn't foregrounded at all in the DASH risk model. Officers didn't know which questions, why they were being asked to ask these questions. A lot of questions were being missed off or left off or garbled at the scene. And what we proposed was a much shorter risk tool that foregrounded coercive control throughout the entire risk tool. So it was no longer relegated to a couple of questions, and it was much more threaded through every single question. And another thing that we wanted to address in the risk tool was that the DASH was simple yes or no answers, and often what would happen at the scene is a police officer would ask the victim one of the questions, and she would say, well, yeah, he does that all the time. And the officer would say, well, what about tonight? What happened tonight? And if it didn't happen at that instant, they would tick no for that question. So it really missed the ability to nudge officers to see any patterns because the tool itself was asking just for yes, no response options to what had happened at that particular incident. And it was going against all of the understanding of coercive control as about being a pattern of behavior. So we designed a new tool that foregrounded coercive control in all of the questions, and it also changed the response options to get away to address that issue. And I'll show you, I have a slide of the tool. You won't be able to read it, but you'll just get a sense of it. That tool was then tested in a few police forces, showing promising results in terms of increased crime recording around coercive control. So compared to the Dash, it was doing a better job in that regard. And it has been planned for some time, actually, given that the review came out in 2016, that it would become the national model. COVID got in the way, as it did, with a lot of things. It's still endorsed as the national model, but I think, describing that big infrastructure, the risk-led infrastructure in the UK, altering that at all was deemed to be a really significant issue, and so the current plan is that the new risk tool is for frontline officers to use. And then those other partner agencies that might have more time or be engaging in the risk assessment in a totally different kind of context can use the original Dash. So how that will work, I'm not too sure, but that's where we are at the moment. And so that's just an example of some of the main body of the risk tool. There's also some other questions there about getting an officer's narrative around the most significant aspects of the case and the victim's fear. But importantly, I think those response options along the top, that was an easy win. It doesn't take more time, and it provides a hell of a lot more information about what's going on in that relationship. And then these two slides are around the evaluation of the new tool, and the blue line there showing increased recording by police using the new tool in the pilot areas. So I'll just move on now to some of the work we've done around nudging better identification and response to offenders. So this work started off in Wales, where I am, and we had a case in 2014. So again, are all around, the same time, a case where a young mother who was under 18, who had just come home from the hospital with her newborn daughter who had severe physical disabilities, was killed in her house along with her mother where she lived. So it was 3 generations of a single family who died in a house fire from a perpetrator who was very well known to police in other areas, not in South Wales. And it really prompted practitioners in the local area to think about how they could draw together information better around offenders. So that entire risk infrastructure that had been built up was really foregrounding victims. It was all about a victim's response to the Dash, a victim getting IDVA support, a victim being referred to Merrick. And meanwhile, only probation had any responsibility, as it were, for managing offenders or perpetrators. And so, in that progressive change to the landscape, there is also this massive problem that was an unintended negative consequence, that the perpetrators causing all of these high-risk victims to go to Merrick were pretty much off the radar and invisible to agencies unless they had a conviction for domestic abuse and were being managed by probation. Or another way of saying it is that a lot of agencies had some idea of who the really bad active offenders were in their local area, but they had no mechanisms in place for sharing that information. So we set out to design a solution to this, or at least try to get closer to a solution. And we created, it was co-created with police and probation and specialist service providers in Wales, coming together and wanting something short and sweet, which would enable agencies holding information about perpetrators to log that information and for there to be decisions made around who were the priority perpetrators in a local area, and then something to be done about those priority perpetrators. So the PIPIT, it's like a tongue twister. The Priority Perpetrator Identification Tool was developed and tested in Wales across different agencies. It then using historical case files, so probation and police and specialist domestic abuse services, using the PIPIT against historical files and seeing like how many would be judged a priority perpetrator, what were the different issues there. And then we tested it in 3 police force areas where they were creating an intervention around priority perpetrators based on different agencies completing a PIPIT and then sharing that information, so that there was a similar kind of model to the Dash Merrick model, but for perpetrators. And what that, similar to the review and revision to the Dash for victims, I mean, what the main highlight of this research program was to show that as well as victims, practitioners can be nudged to better ID and respond to offenders if they have tools which prompt them to think about coercive control and to record that. So the PIPIT is a short form where we're asking about these 10 items, and also whether it's recent or is there evidence of these behaviors historically. And so it's quick for practitioners to fill out and then to share this information. It doesn't require any specific access to, other agencies' recording systems or, like a SARA risk score. It's just practitioner's judgment. Has there been a worsening of mental health? Has there been a noticeable increase in alcohol or drug misuse? Do they have offending that's serial, involving multiple victims? Is it repeat? Is it escalating? Trying to focus practitioners on those offenders who are active, who might have other co-occurring problems that are escalating in seriousness, and where an intervention, a multi-agency intervention, would be warranted. And so this form was implemented in Greater Manchester and Dyfed Powys Police in Wales and in Hampshire in southern England. And they each had a kind of different models for how they used the PIPIT and what they did with that information. I think by far the most successful model has been what's happened in Hampshire, which is one of the home counties in southern England. They've always had a very well-developed service provider landscape for perpetrator programs, perpetrator initiatives. So they had a lot of ways of managing the risk. What do you do with a priority perpetrator who might have mental health problems, alcohol and substance misuse problems? They've got this escalating behavior going on. it's not all perpetrator programs are the same. Not all perpetrators are suitable, and they had, a more developed offer. And I think what's come out of Hampshire is this Operation Foundation, where they've made these high harm teams to deal with their priority perpetrators, um, to manage them. And by that, they use disruptive tactics, like disrupt and deter. So they do provide services if services are warranted. They also, they use the carrot and the stick approach. And so that's been a very successful, over time, it developed into a successful county-wide domestic abuse prevention partnership intervention for priority perpetrators. And what the PIPET research showed was that if you ask practitioners, well, what are some of the key considerations for your judgment that this is a priority perpetrator? Coercive control came out really strongly. So that helped to reinforce to them about looking and evidencing coercive and controlling behaviors, that it was, in other words, rare that they were going to have someone with those kinds of characteristics who was not going to be engaged in coercive control. So the kind of DASH, revisions to DASH, and the PIPET and how that's been used in practice are both examples of kind of using tools to nudge practitioners to see and respond to coercive control. And then we also have examples of where it's been kind of considered that we need to carve out an alternative to a business as usual approach. And this piece of research came about in South Wales. It's about specialist policing units for violence against women and girls. And initially it started as they wanted to test out video, like rapid video response. So putting victims in touch with police investigators, basically by Teams, or by Zoom, something digital. And what they found is they had decided on a cohort of victims who did not, they wanted to focus on victims who were clear at the initial attendance by the response officer that they did not want to engage with criminal justice, and the perpetrator was in custody overnight. So they were targeting the team on those cases, on that cohort, which is the more challenging cohort, right? Victims don't want to engage, the perpetrators in custody. You're probably not going to Teams your way out of that. And what they found was they tried to do that. It didn't work, because what these victims needed was a different kind of response. And I'll talk a little bit about that. We took those findings and tested them with other police forces around Wales, trying to get a sense of, well, what does it mean to be a specialist unit? Because there's lots of that term is used quite a lot, but there's a lot of variation underneath that term. And what came out of those meetings were these key ingredients of what they considered to be necessary for a specialist police unit. Obviously, having specialist knowledge or expertise is important, but what they were keen to point out is that couldn't come entirely from a training program, that it was the officers who wanted to be there, who were supported to work in a team, and who understood a kind of clear mission and goals. So partnership working, having a victim-led approach, these were the key ingredients that police were keen to promote as necessary for any specialist unit for tackling violence against women and girls. And so for this specific unit that we did a deeper case study into, it was termed Operation Diogel. I know I'm mispronouncing that. It's the Welsh word for safety, Diogel. And this was a team of a sergeant and 4 or 5 investigators, and they were basically taken away from providing a business as usual approach. They did not wear uniforms. They didn't have radios going on their shoulders. They didn't have the pressures of the control room telling them, sending them from one call to the next. They could use an unmarked car. And they had a really clear aim, which was to go and visit victims in person and be able to spend enough time with them that maybe they would change their mind and they would provide a statement and engage with the criminal justice response. But maybe not, and that was fine too, because they could give information about safeguarding, maybe linking them to local services, and they also did some joint visits in that regard as well. And what our evaluation of that approach showed was that it really did promote many more positive outcomes than were expected, especially considering the nature of the cohort. So I know this is a lot of information to take in, but what you're looking at is a comparison of the cases, the victims that were referred to Op-Dargel, and those are the stripe bars that are the tallest bars. And you see that they achieved more positive outcomes. And by that, I mean positive in criminal justice terms. So charges, arrests and charges, victims giving a statement, even though they told the response officer they did not want to engage at all. And you see it's compared to other areas of the force. So much higher rates of positive outcomes. We also had victim satisfaction survey data, which showed, again, the stripe bars are the ones that received that specialist unit approach. And there at every point of the investigative process, they were saying they were completely satisfied at significantly higher levels. They also reported being better informed, safer, and more confident compared to those that just received the business as usual approach in the rest of the areas of the force. And so what also came out of this study was the necessity of having those kind of different mechanisms for creating a safe space for victims, particularly those victims who want to disclose coercive and controlling behavior. So there was one example of, sorry, I'm trying to get rid of this. One example of a victim who, sorry about this. One example of a victim who wanted to give a statement about her experiences of coercive and controlling behavior. And this ended up being an 18-page statement that took the officer 2 6-hour sessions at her home to take. And those kind of offenses, that kind of offense is not going to be amenable to a kind of rapid video technique, or it's just important to be mindful of these alternatives are necessary, or rethinking what is a business as usual approach is necessary when it comes to coercive control, because coercive control is a course of conduct. It has a much more significant impact on victims and how they might engage with practitioners. And practitioners are not going to be able to identify and get disclosures if they're doing their normal ways of practice. Instead, there needs to be alternative pathways to try to engage with those victims. So just in terms of wrapping up, I know it's been probably a really full-on hour of listening. So in terms of Canada and where you are and what maybe you've learned or can think about or apply in your local areas from our experience in the UK, is to think about what are the ways, and it won't probably be one way across the entire nation or across an entire type of agency, but think about the different ways that practitioners can be nudged working in different areas, different agencies into seeing and responding to coercive control. So what are their current tools and ways of working? And those need to be looked at in terms of how visible or otherwise coercive control is within them. What's the training to support the implementation of any new law so that unlike how we started where we really made a law without hardly any support for practitioners. What are the ways that practitioners in Canada can be supported to implementing the law better? Focusing on safeguarding and criminal justice outcomes is really important in terms of measuring performance. I mean, a lot of the information I showed you coming, at a national level is focusing on criminal justice outcomes, how many arrests, how many convictions, and those do give an insight, but they say nothing about whether victims were made safer or whether their lives improved from engaging with those agencies. So safeguarding, are victims safer? Did they get referrals to other agencies? Are other aspects of their situation been addressed, which has made their lives better in terms of housing or health or education for children? And this has only recently come out in the UK about a national policing level to say that actually safeguarding and criminal justice outcomes both need to be measured when it comes to violence against women and girls, which is that's a big change for police. And then finally, thinking about the business as usual approaches, pathways, that victims typically travel down now in Canada before the law is in effect, and how those are going to come up against, just victims being able to disclose when the law is in effect, and thinking about whether those kind of alternative pathways can be implemented in certain areas or tested. And procedural justice theory has become a big framework for understanding how to improve engagement and justice for victims in the UK. And I can talk about that more in the questions if you wish. But for now, I will stop talking because I think you've had quite enough listening, and I would like to hear from you if you have any questions or comments to share. Thank you.
Thank you so much, Dr. Robinson, for a really engaging and informative presentation. I know it's hard talking into a black box, but I, for one, was sitting here taking lots of notes. I think you've given us a really clear picture of the context and some of the issues around the law enforcement response to coercive control in domestic abuse cases in Wales and in the rest of the UK. And I really appreciated that you were able to share some of your recent work there too. So just to remind today's audience, Dr. Robinson's talk is the first in a series of Waypoint Talks this fall on coercive control. And this series is part of a project funded in part by the Social Sciences and Humanities Research Council to examine how we understand and assess coercive control. And this Waypoint Talks series is a platform for us to hear about the research and practice that's happening in the UK and also later in the USA and New Zealand. And that's going to help us identify some of the needs and gaps in coercive control research in Canada, where we anticipate that coercive control will be a criminal offence in the near future. So, Dr. Robinson, I'd like to start off the discussion with a question for you, and then I'll hand back to Christy for moderating the discussion time. So, and I'd like to go back to a figure you showed early on, the bar graph showing that over time, coercive control offences went from only 1% up to 5% of domestic abuse cases. And you made a good argument that this is greatly underrepresenting the actual incidence of coercive control. But I still see that small increase over time. And you've advised us here in Canada to think about how best we can nudge officers to capture coercive control. So I wonder if you can tell us what you think most contributes to that slow increase. Is there a growth of training for officers having an effect, or changing attitudes, or the new tool? And then you also showed the effects of the, if I say it right, Diogel program. And
Yeah.
then maybe victims are speaking up more about coercive control as they learn that it's now an offense and it's going to be handled effectively. So if you had to prioritize, what would you think would be the most key thing for that change?
Oh, Zoe, that's a that's a tricky question. I mean, there's obviously a lot of factors that account for that change. I mean, one thing I would say about the training program is when that was evaluated um, in one force in England and Wales, it showed a 41% increase in recording for coercive control offenses once everyone in the force had been trained on DA Matters, which is the name of that program. So I think that I do think the training program is important, but I think what will be interesting to see is now that we are in a state where of 2024, where most of that coverage is there, and the the tools have changed, but not in all areas. I wonder if there's going to be a step change in terms of increase. Because right now, most police forces are still using the dash. So that I think is problematic because we've known for a long time that the dash needs to change, and we have a model ready that's evidenced how it helps officers identify coercive control. But for, political reasons and, lots of reasons, that just hasn't become a national rollout of that new risk assessment tool yet. So I guess what I would say is the priority is to have the training with the tools aligned to the training, because we had a flurry of a few years where a lot of things were happening at once. We had a new law, we had a review showing that the police risk tool needed to change, but that still hasn't been implemented as we would want. We had a new training program that has taken a long time, but has finally, is really, we're on track there. And the national goal is to have all police forces in that dark blue color of the map by April 2025. So we've just done things, kind of at different paces and not joined up. And I think if you're going to invest in the training, the tools and the training need to be really in sync. And we weren't really able to do that in the way that would be the easiest, that would be the most helpful for practitioners. So I would say that would be an important thing to prioritize.
That's great. Thank you so much. I'm just going to encourage folks, please add your questions to the Q&A box or in the chat as well. And Dr. Robinson, there's lots of positive feedback in the chat, which is great. One question I had while we're seeing if anything else comes in is at the beginning, you were talking about the reporting rates and how there's such a difference in domestic abuse reporting and coercive control, though it is increasing. And I know that that data is still developing, but I was curious if there are any trends in that type of reporting that you are seeing in terms of when something is reported as coercive control.
Well, that is a very good question. I mean, what we know from the data so far is that when cases of coercive control go through the criminal justice system, so we have people convicted and sentenced for it, we tend to see that police are still really only investigating the coercive control offense when there's lots of other offenses they can investigate for at the same time. We rarely see a standalone coercive control conviction. Rather, we see coercive control with physical violence, with sexual violence, with, and it shows a lack of confidence on the part of the police that they feel that coercive control is a really hard crime to evidence, that you need to have a ton of evidence to go for it. And really you want to, have a safety net or hedge your bets by only going for that offense when you have other offenses alongside it. So most of the convictions are, I mean, what we would expect, that they're for men, coercive and controlling women, as that kind of gender split we would expect. But what is very true is that they rarely go through the criminal justice system without those other offense types alongside. And I think if we could see over time that that was changing, that would be evidence of, more confident recognition on the part of practitioners about how to evidence the new offense. I think it can be taken as a proxy for a lack of confidence.
Yeah, absolutely. And that kind of lines up with what I would have guessed. So thank you for explaining that more. We do have some questions coming in, which is great. So one question in the Q&A, when describing instances where police would interview victims and mark yes or no, they tended to mark no if the risk factor did not occur that evening, which undermined the purpose of the assessment. Was this due to a lack of understanding that they should mark yes if the risk factor had ever been present, regardless of whether it appeared that particular day or evening?
Well, it wasn't a mistake. I mean, really, the dash risk tool was always reinforcing, unfortunately, to some extent, the kind of incident driven mindset for police responding to domestic abuse, as in the dash risk assessment was meant to be about that incident and not about the entire relationship, although that's what the victim would tend to want to speak to. But the dash was really meant to be like about that incident, and maybe they could put some narrative comments, or they could add that dash to all the other dashes that might have been carried out for that, for that poor victim or in that relationship. But the dash, if they were marking no, it was because it wasn't present at that time in that incident, and that wasn't a mistake on the part of the officer. That's part of the problem with that risk tool, is that it's designed to capture what's happening at that incident, whereas the DARA, the revised one, is more about capturing, the lived experience of the victim, and it gives those options accordingly.
That makes a lot of sense. Thank you. Another question, how are the CPS with bringing charges for coercive control?
Well, I mean, they will bring charges for coercive control if the evidence is there, and it has to pass the two-pronged test, the evidential test and the public interest test. If it falls down, it's usually because of the evidential test. We know that one of the most common outcomes from charges for coercive control is evidential difficulties. The victim does not want to proceed. So, victimless prosecutions are very contentious, as they should be, because you can only really evaluate them on a case-by-case basis. For some victims, that might be exactly what they want, is to be taken, for it to be taken out of their hands and the prosecution go, without their direct involvement. But for others, it could be, experienced as a re-victimization and very disempowering. So how to use evidence where the victim does not want to engage. Although there's a policy that allows that to happen, I think it is still very contentious, and rightfully so, because I don't think a universal policy would ever be right in making those decisions. But it does mean that, for body-worn video, for other evidence, which doesn't require the victim to be in court engaging with the criminal justice process, I don't think we have a very coherent approach of what to do, where there might be ample evidence of coercive control through online phone records and body-worn camera and everything else, other people's statements. But I think there's still an acknowledgement that if the victim doesn't want to proceed, that is problematic just to overrule that in every instance. So we're still, like, I think, in a very there's a lot of variability there about how that would be dealt with.
That's very helpful. Thank you. And ties nicely into another question we have. So, someone is saying they're interested in thinking about fear of police violence and hesitation for victims to report, and how this fear might be higher in some communities than others. So, are you able to speak to any alternatives to reporting for victims who don't want to engage the CJS? Which other practitioners could victims report to? And is there a role for community organizations in the UK to raise awareness or reporting about coercive control in the criminalized context?
Yeah, great question. There are other ways of reporting. For example, we have in health, we have National Health Service. I know you have something similar, which is great. As an American, I can say, like, thank God for that. But we don't, despite the NHS, we still don't have what we would consider to be a whole health response to domestic violence and abuse. We do have pockets of really good practice, which go beyond, a single type of healthcare provider, like just maternity or just mental health. But we rarely see where it's really joined up in terms of healthcare. But in terms of reporting, so one of the things we know from domestic homicide reviews, unfortunately, is the role that GPs play in disclosures, general practitioners. So we know that can be that is often a more likely professional to be told about abuse than the police, right? I mean, people usually go somewhere else before they go to the police anyway. And so general practitioners in the UK, we have a model called the IRIS model, which stands for Identification and Response to Improve Safety. And that model is about embedding a specialist victim advocate in GP surgeries, training the GPs, and better recording so that so they don't have to do routine inquiry, but under certain circumstances, that prompt of asking the question should come up, and that should be recorded. But importantly, because the advocates are embedded in the surgeries and that there's links to specialist services, the GPs are less afraid of asking and getting a disclosure because they have something to do. They have somewhere to take it. They have somewhere to refer on to. So the IRIS initiative is evidence-based as really changing the practice of doctors. And that is a really important element. And I think that's probably the closest we have to something that's just about national as an alternative intervention. I mean, of course, we have national helplines, and those kind of ways that people can get information and make a report. But I think the IRIS program is very promising in terms of really increasing the responsibility of a different kind of frontline practitioner who comes into contact with members of the public.
That's great. Thank you. I have one last question for you, and then a smaller question. Just folks are asking if they can connect with you if they have more questions or want to learn more about your work. So if you're able or comfortable maybe to share your email, some
Sure.
folks would be happy to reach out. And then one last question about your presentation. So can you tell us more about the training that law enforcement officers had received for investigating coercive control, specifically what was covered and how it was rolled out across the UK?
Yeah, so the name of it is DA Matters, Domestic Abuse Matters, and you can find information by searching online. I mean, it was co-produced by the College of Policing and the charity Safe Lives. Safe Lives are a national charity. They were instrumental in the MERIC implementation program. They have, you know, they've been responsible for really professionalizing a lot of the NGO, specialist sector in terms of standards and creating consistency across different areas. And so together they created a training program which has different aspects to it. I think one of the most important aspects is that there is a full day in person, which involves listening to specific local case examples and role playing how that investigation and response should be carried out. And that is then complemented with other kind of learning modules and aspects. But that face-to-face and role playing through specific examples is really important. I think it's important to say as well that policing has just had a massive refresh in terms of how it in terms of policing investigations with regard to rape, which is not obviously exactly the same thing as domestic abuse, although there is an overlap. And so there's been a major change program known as Operation Soteria, where Soteria is the Greek goddess for harm prevention. And it involved the 6 pillars framework around the investigative journey, victim engagement, digital evidence, et cetera, et cetera. And that program is also really important, is a really good, I think, source of information and resource in terms of thinking about how police investigations can be improved in other areas and for aligned offenses, where there could be real problems with victim engagement, victim trust, establishing more than rapport. You need a different kind of investigative model to really to hold those cases well. That you can't apply what you do to a car theft victim, and roll that over to a rape investigation, and likewise for coercive control. So we're looking to apply the Operation Soteria, which created a national operating model for rape, and to do that for domestic abuse starting in 2025. So in terms of investigation and police training and all, and to your point, I think that those are all parts of the same whole. And but yeah, domestic abuse matters would be the name of the training program. And I know that part of that implementation was to train champions in the forces. And then the forces also become the training provider, like an accredited training provider. So it has standards and transparency around who's allowed to deliver the training, what it means to deliver the training, what it means to complete the training, how to how to keep track of who's done the training. It's all part of a whole a framework that is important as well as the actual content.
That's wonderful. Thank you so much for sharing that and for such a great presentation. I certainly learned a lot, and I know our audience did too. So thank you so much for your time today.
Thank you.
I'm not seeing any other questions, but again, if you want to learn more, please feel free to reach out to Dr. Robinson. And we just have a couple closing slides for you, and then we'll sign off.
Okay. Have a great day.
Thank you. All right, so the recording and slides will be on our website after this event. We will also share that post-event survey. We really appreciate you filling that out. It helps us improve our future Waypoint Talks events, and you can receive a certificate for professional development. Please contact me. My email is on the screen there. It's kallen@waypointcenter.ca, and I would be happy to send you over a certificate. So we have another talk coming up in the coercive control series. Our next session is on Thursday, October 10th. It's from 2 to 4 p.m. And we have Dr. April Joliffe Simpson. She'll be presenting her talk on improving the prediction of intimate partner violence by identifying coercive controlling behavior in police reports. And this is specific to the New Zealand context. So we hope you'll continue joining us for this series. We really appreciate your time today, and thank you again, Dr. Robinson, for a really fantastic presentation.
Thank you for your time.